I was taking care of my grandmother a few months back, and she was getting sick, and I found out I was pregnant. I called Hannah, and I talked to Hannah privately, and I told her what was going on. I ended up having a miscarriage, but she was there with me every step of the way. She was even willing to go to the doctor's appointments to support me. It's just great having support from everyone here, and everyone plays their own role.
We all know that there are healthcare disparities. People who are experiencing homelessness don't have the same kind of access that the rest of us have. And so having somebody here on site that had the resources and the skills to be able to connect people to the things that they didn't even know they were missing changed everything for us.
The other kind of misconception, or what people maybe just don't really understand, is how important health and basic healthcare is for people who have housing and food instability. So having the healthcare, the basic kind of health and nursing care on site, and having the Health Navigator like Hannah to help the guests support their own health, identify like any kind of emerging kinds of issues, and then help them to get connections for the ongoing health care as an integral part of it is super important.
So I wear a lot of hats. My day has never looked the same ever. Healthcare Navigator or Health Navigator is a really broad title because health is really broad. So there are some days where I'm sitting down with people and we're just renewing their Medicaid or enrolling them in Medicaid, checking in on their insurance. Tracking down medication is a big thing that comes up. People maybe are coming out of the emergency room and they don't know what pharmacy they sent to, or they kind of have a constellation of care providers and they don't know where things are getting sent to. We have a very generous grant that funds this program, and there is a transportation budget that becomes wildly handy in situations like that, where we can just, take a cab pretty much anywhere around town and get people where they need to be.
I have always tried to find opportunities to volunteer with my dental care because it's a very tangible, easy thing to give to somebody. I'm drawn to healthcare because I love making people feel better. And so for me, walking away knowing that I gave someone the gift of being a little bit healthier and feeling more confident and proud of their body, that is huge. And I feel a sense of responsibility. I had a lot of people help me get to where I'm at. So every time I can give that to someone, it feels like a little bit of, paying it back and even paying it forward. It's part of my life's mission to look for people in need, help them, and imagine that they're going to go on and help someone else. I also feel really passionately about helping women in need, so it felt like a very specific calling to be here at EGH doing some dentistry.
What I have learned is that food is not just our nourishment. It is also, in so many respects, our life enrichment. And so I try to make sure that when I am feeding people, I am not just feeding their body. I am feeding every single part of them, and I am giving them a real sense of home from the ground up.
The Pacific Hospital grant was a game changer for us because it allowed us to do things that we'd only dreamt of doing before. Like, we could see the gaps in services. We could see that there were needs that were not being met, but we didn't have the resources to help connect people to those things. And so having that money, and being able to imagine something bigger for ourselves, something that maybe other organizations haven't even had the opportunity to do yet, was a game changer for us.
I have everything from cough drops, acetaminophen, ibuprofen, to pregnancy test and Plan B. Like, I can keep basically everything on hand for any moment in time. Things like vitamins, especially for our aging clients, are really important. Basically, nothing that we do here would be as successful with the Health Navigation program without that grant. It just allows for all of this to happen.
I can say without any hesitation at all that every single person here, we all really, really care about every person that comes through the door and what they need.
The reason this place can keep going is that a lot of the people who pass through here are the people who volunteer later to keep it going. It's really good that there's consistency here, because service to the people who come here suffers when there's not consistency.
They get me what I need. And I mean, it's just an amazing program. And they love what they do here.